My mind is upset. I can change my mindset. Do not be thrown offset. Rumor time, reset. Rumor time.
Good evening, everyone. My name is Vanessa Kelly Brew, and I am one of your hosts for the ARC podcast.
My name is Dr. Yvonne Marie Laria, and I am one of your co-hosts for the Access RUMERTIME Conversations podcast.
There you go.
Good evening. My name is Georges Prosper, and I'm also one of your co-hosts at the Access RUMERTIME.
Good evening, everyone. My name is Lynn Prosper. I'm also one of your co-hosts.
Welcome back, everyone. We took a couple weeks off, but we are back. And this month is May. And so the month of May is Mental Health Awareness Month. And so what we wanted to talk to you all about tonight is we wanted to frame this conversation around mental health awareness. And so we are going to ask Dr. Yvonne Laria if she would give us a definition as to what mental health is.
Okay. So, good evening, everyone. As we said earlier, GCSCORED has a different take on mental health. And we use a definition. We've developed a definition for mental health that uses destigmatizing language and is grounded in social emotional wellness. So our definition approaches mental health from a social emotional wellness perspective. And so I will share that with you this evening. And so that, like I said, the approach that GCSCORED uses to describe mental health comes from a social emotional wellness perspective. And we believe that in order to achieve body, soul, and mind balance, intra and interpersonal body, soul, and mind balance, that we must intentionally and consciously focus on the roots, which are relational capacity building skills and the conditions or resources that are available to individuals at home, school, work, and in the community so that growth and development can occur. We also interpret many symptoms, behaviors, feelings, labels, and diagnoses as fruits, outgrowths, and manifestations of the activities that are occurring at the root level. Okay, so let me kind of restate this. The way that GCSCORED approaches mental health, we use a social emotional wellness perspective. And we've developed a definition. And that is, we believe that in order to achieve triadic balance, triadic meaning body, soul, and spirit, the intrapersonally and interpersonally, in order to achieve that type of balance, we must intentionally, meaning on purpose, right? We must on purpose and consciously focus on the roots of the resources and the conditions in our homes, school, at work, and in the community. And this focusing on the root causes or the roots of these conditions and resources at home, school, work, and in the community, they help in our growth and development. And additionally, we interpret symptoms. When we talk about somebody has anxiety or depression, or a child has ADHD, or any number of behaviors and feelings, um, any number of labels and diagnoses, we interpret those as fruits, outgrowths, and manifestations of activities that are happening at the root level. Okay, so that's how we define mental health at GCSCORED. And when we look at the World Health Organization's definition of mental health, we see that similar language is used as in our definition. And so the World Health Organization, according to the World Health Organization, mental health is defined as a state of well-being in which every individual realizes his or her own potential. The individuals can cope with the normal stresses of life, and they can work productively and fruitfully, and they're able to make a contribution to his or her community. So that's the World Health Organization's definition.
All right. So according to our GC scored, we are looking to achieve interpersonal and intrapersonal balance, right?
Correct.
And so to do that, we have to focus on the root
Mm-hmm.
of a situation.
Mm-hmm.
Okay.
Mm-hmm.
And that means we are working to build our relational capacity.
Mm-hmm.
Okay.
And and what that is basically the 5 social emotional competencies, right? The relational capacity building skills are the 5 social emotional competencies, because they are separated into intrapersonal and interpersonal.
Mhm.
And those are the skills. Those are the skills that we need. Those are building blocks, if you will, building blocks for building relationships,
Right.
upon which relationships are built.
Right.
Mm-hmm.
And so again, interpersonal is the relationship that we have with someone outside of ourselves.
Correct.
And intrapersonal is the relationship that we have with our own selves, the
Exactly.
thoughts that we have.
Right.
And then how we then act upon those thoughts.
Exactly. And how we feel about ourselves.
Right.
Yes,
Okay.
absolutely.
All right.
Absolutely. And so when we look at the World Health Organization's definition of mental health, when we look at what Dr. Lynn Friedley said in 2015, and they said everyone has mental health needs, whether or not they have a mental illness, just as everyone has physical health needs, whether or not they're sick.
Mm-hmm.
And so I really like this quote, because what it helps to do in a specific way, it helps to normalize mental wellness,
Mm-hmm.
right? It's again, it says everyone has mental health needs, whether or not they have a mental illness, just as everyone has physical health needs, whether or not they are sick. And one of the things that we have to do in our society is make the promotion of mental health and social emotional wellness, make it a universal public health concern.
Mm-hmm.
And one way to do that we have found at GCSCORED is to destigmatize and demystify the language surrounding mental health, mental wellness, mental illness, and disorders, and all the terminology that goes along with mental health. Because when we look at the building blocks of both these definitions, the mental health definition and the social emotional wellness definition, they have the exact same building blocks. So mental health, included in the mental health definition, is emotional, language, psychological, spiritual, social, and physical wellness. When we look at social emotional wellness from a triadic perspective, meaning body, soul, and spirit, we see included in that definition emotional wellness, social wellness, intellectual, spiritual, physical, psychological wellness. When we look at again the mental health definition, we see how it talks about how and what we think, feel, believe, and act impacts our mental health. Is the exact same thing we see when we look at the social emotional wellness definition. And we can go on and list the similarities in the building blocks. And so it begs to question, why are we as a nation, why are we as a people continuing to use language that is stigmatizing when we can, in truth and in fact, use language that is destigmatizing and that is what we call access producing language. Okay, the language that we're using helps us to increase access, as opposed to language that decreases access or stands as a barrier to access.
Mm-hmm.
And so I want us to have that discussion this evening about how we see this COVID-19 impacting our mental health and how we could influence making a difference in people's lives by choosing intentionally and consciously using destigmatizing and demystifying language.
I think that's a great way to start by taking away the stigma from mental health, because right now people don't want any new things to think about. They have already a lot on their plate. Over 30 million have lost their jobs, and they're trying to figure out how am I going to pay for rent? How am I going to pay for food? And for those who are going to get food at the food banks are starting to run out. For those who love meat, you know that the meat packing district right now is riddled with COVID-19.
Mm-hmm.
So many different things that you have to wonder about. Am I going to focus on food? Am I going to focus on my bills? Well, all of that is also something that creates unhealthy atmosphere for us to think negatively. And we're trying to step out of that, but you don't know which way is out, because your state could say it's time to reopen up.
Mm-hmm.
As new cases continue to rise. So your anxiety is starting to pick up, but you don't know what that feeling is.
Mm-hmm.
But just know that there's this feeling of uncertainty that's coming on you, and you're saying, I feel very stressed and very bothered when I hear that this is happening within my community, but I see the catastrophic things that are also happening because of COVID-19, and I don't see the numbers going down, but I see stores opening up. I see them telling us to go back to work as if it's okay. I don't. If you have a health condition that might make COVID-19 cause you to lose your life, like how do you deal with that? Or if you even have family members who are within that age range that might affect them in a certain way. So now do I start distancing myself from my loved ones because I want to make sure that they're safe? There's so much that's on their plate, and we don't know what to do right now.
Mm-hmm.
The uncertainty is so big, we don't know what to do. And now, am I going to deal with my mental health? What is it like to start dealing with your mental health? And it's simply just having a conversation with someone because you can't handle everything that's happening around you right now. And I think once we start framing it in a way that's more helpful instead of scientific or ways that help us to feel like access is only granted to certain groups of people, now people will want to gain access to say, I would love to talk to someone about the stuff that I'm dealing with. And to know that when I speak to someone, it doesn't make me less of a person, but it's just letting me have an opportunity to exhale about some of the things that I can't control right now.
Yeah, and I like the point you're bringing up here, Georges. And if I were to summarize that, is what you're saying is, can we not pathologize people's responses to the social, economic, relational consequences of COVID-19? Can we not put a label and say, okay, this person is diagnosed with anxiety. Mm-hmm. What this person is dealing with is the consequences, right? The inter and intrapersonal consequences of COVID-19 mm-hmm. and all the outgrowths of that. And so when we refrain from pathologizing people's life stories and people's experiences, it frees individuals up to move through life not feeling like they have a deficit, but understanding that they are responding to life's challenges in the best way they know how. And I think they would be people would be more open to, like you said, to coming and asking somebody to, here's what I'm going through. Is that something you're going through as well? It makes it more relatable and not put so much shame and mystery and, pathology on it.
Mm-hmm.
That's the truth.
Yeah.
Okay. All right. Well, thank you guys. I think that is very important. I mean, to be able to express how you feel without having the shame behind it. And so when we come back after this commercial break, then we will get more in depth about how some of the people are, some of the ways people are able to do that, to share their thoughts and feelings with each other.
Are you and your family seeking healthy mindsets, actions, relationships, knowledge, emotions, resources, and skills? Well, backed by popular demand, GCSCORED presents RUMERTIME Family Summer Camp, a social emotional wellness program starting June the 14th to the 26th at the venue St. Michael and All Angels Episcopal Church, down to the roots.
The Access RUMERTIME Conversations podcast is brought to you by GCSCORED and the Leadership Institute, and your co-host, Dr. Yvonne Murray-Larrier, Dr. Geneva Fleming, Vanessa Kelly-Brew, Lynn Prosper, and Georges Prosper. Thank you for listening.
Welcome back to the Access RUMERTIME Conversations podcast.
All right, welcome back, everyone. In the last segment, we were just talking about Brother Yvonne had given us a definition, GCSCORED's definition of what mental health is, as well as the World Health Organization's definition of mental health. And one of the things that we discussed was very important is understanding that we need to use destigmatizing language around mental health, right? Because one of the quotes that Yvonne also shared from Len Friedley is that everyone has mental health needs, whether or not they have a mental illness, just as everyone has physical health needs, whether or not they are sick. And so when we left off, we were talking about some of the social, emotional issues that people have been dealing with regarding this COVID-19 pandemic. And we want to delve into how people are dealing with that, how people are dealing with the isolation, how people are dealing with the frustration. And I think one of the things that Georges had mentioned was about economics. You know, there are people who have lost their jobs throughout this time. So how people are dealing with these issues. One of the things that I will say is that I know that I watched a podcast, and this was a podcast with women who were talking about how this the isolation has affected them. And so there were women who have different lives, right? So there are women who are married, who have children, who are home all day. There are women who are single, who are not in relationship with anyone, and who do not have children, and how they are also being affected by this. And so I do recall one lady who was saying that for her, this has been a very deep and powerful awakening for her, because one of the things that she has realized is that before all of this happened, before we were quarantined, she was the type of friend to others where when there was a christening or a baby shower or a birthday or whatever it was, that she was always the friend who was right there. But throughout this period of being quarantined, she is feeling very much alone, because she's saying the people that she expected to, that she showed up for, she expected that they would also show up for her. And she is seeing that she is, very much alone through this process, and has had to get to know her neighbors in a way that she had not done before. So if something happens to me, I need you to understand or to know that, this is where you find this, or this is what you need to tell my family. So she, is experiencing, this pandemic in a very different way than, someone, who has a husband and children at home.
That's a really profound, sobering account there, Vanessa. That is very sobering, because it's making me think of so many people are single, and we say when I was single, you enjoyed your singlehood, you enjoyed coming and going as you please, you had your network of friends, and which is what this lady is saying. But now that we cannot physically connect, she is seeing how alone she is. And I am sure there are millions of people experiencing those similar thoughts and emotions, and how, and I'm just feeling the weight of just hearing how you related that story. I feel the weight of isolation. I feel the weight of fear. If so, because when I was single, I used to say to my girlfriends, most of us were single around the same time, and if I get sick, I would call them and say, okay, I'm sick. If you don't hear from me in such and such, come and find me, call the police, because I don't want to die in my apartment by myself. And I mean, it was half joking, but also half serious.
Yeah.
But and so this lady's experience is exponentially more intense.
If I could share, I mean, that it really gives even more credence to the quote by Dr. Lynn Friedling. And it also reiterates the impact of this pandemic, how it has affected all of us in ways unimaginable. And what it says and how it connects with Dr. Friedling's statement is that, everybody has mental. Read the statement again, just so I can be clear.
Yeah.
Whether or not you have a diagnosis or have been labeled or carry a language around, which is something GCSCORED adamantly opposes in terms of labels and languages. But this particular story that I just heard, it validates what the Dr. Freely is saying about mental illness. Even I'm going to say the quote unquote, the healthy of us, the best of us can experience these challenges, because it's a whole nother layer of something that we never imagined, we never faced, we never had to apply even our mindset to that kind of thought. We're so used to the quote unquote normalcy of life. And so this pandemic has just disrupted all of that. Yes, thanks for sharing that. So everyone has mental health needs. That lady, she has a mental health need. But guess what? She doesn't stand alone. All of us have mental health needs, whether or not they have a mental illness. We all have mental health needs. Just as everyone has physical health needs, whether or not they're sick.
But wouldn't it be easier on the ears and on the mind, right, to change that language? Because as Georgia said earlier, why would we want to add on top of the anxiety, on top of the fear, on top of the overwhelm, a statement that says mental health? You now have a mental health need. You now have a mental illness. And if we could just change that to say everyone has a social emotional need.
We all have needs,
right? Because if I don't know the lady, but let's just say we read something like this to her, or we said something like this to her, I could see her putting up a barrier, because she'd be like, I don't have a mental health. I'm not mentally ill.
I'm not mentally ill.
Right.
Yeah.
But or even more, I'm not crazy.
Exactly.
You're suggesting I'm crazy.
Exactly. Just because I feel lonely, just because I miss my friends, just because I'm isolated because of COVID, now you're trying to label me.
Are you telling me I'm crazy?
Exactly. And so what happens? There's a barrier, the access to help or somebody just sharing even more, it dries up. A barrier just goes up immediately.
And she will not be able to receive
Exactly.
the help that
She
be
needs.
available to her.
Exactly.
I think for some of us, the one thing that, especially because I resonate with the lady, because I would also too kind of like stop talking and refrain from saying anything because I don't want any labels on me. But if you come from a different perspective and tell me, sounds like you're having a rough time right now in your life, as we all are, very inclusive, then if it would open me up more to say, yes, it's not just me. It's not just in my head. There are other people who deal with life like this as well. I think that's why sometimes group therapy has a way of helping people deal with the challenges of life in a better way because you have somebody else that can relate to your pain and your struggle.
Yeah, I totally agree. I think it's critical now more than ever, and to watch our language so that we do not further isolate people and exclude individuals from expressing their thoughts and their interactions. I mean, this lady's interactions have changed as all of ours have changed. Right? Her mindsets, her beliefs about, friendships. She believed that, she was the friend who would go and do an X, Y, and Z. Now her beliefs are being reevaluated because the situations that we're in are being have to be readjusted or disrupted. Her emotions, right? So, which is the time, right? The thoughts, interactions, minds, and emotions, and that's what it is. Let's call it what it is, and stop pathologizing and
using those stigmatizing terms.
Because people don't need that right now. They need open access. People need open access. I mean, we just saw a couple weeks ago the ER doctor who committed suicide in New York. How could she feel so isolated? And I think a lot of it had to do with the shame and stigma that she felt she shouldn't feel what she was feeling. She didn't, because she's an ER doctor, and so she should know better. And the stigma associated with feeling isolated, feeling fear, feeling overwhelmed. She did not feel she could speak up and speak out.
That's another part of that weight that you mentioned early, the weight.
Yes. And so
many people are probably weighted down.
Hundreds of people, thousands of people.
Yes.
And that's why we do what we do in GCSCORED. That's why we are on a mission to destigmatize and demystify mental health, because there are too many people dying, and in myriad of ways.
Yeah.
Because of the stigma and because of the lack of access. And so we cannot continue to perpetuate the barriers that prevent individuals from seeking help and support. We cannot be party to that.
Right. You know, the one thing that I do believe is that Yvonne, what you had said something about um, this lady's beliefs being reevaluated.
Mm-hmm.
And so, one of the things that I do believe is that people will come out of this COVID-19 pandemic very differently than they went into this.
Oh, definitely, Vanessa. You are absolutely right.
Mm-hmm. Yeah.
Absolutely.
In ways unimaginable.
Imaginable.
Right.
Yeah, you're absolutely right. I mean, let's think about it. You shared that one story you shared, and I know each of us has at least one story of how you see people interacting differently now. And at the top of the pre-recording sessions, Vanessa, you shared some incidents or some experiences that you are even having currently.
Sure. Yeah.
Yeah.
Yeah. So one of the things that I shared was that I just had a girlfriend of mine who had a birthday. And so, because we could not get together to help her celebrate her birthday, what we decided to do was to get together via Zoom, right? And so everyone was in their own individual homes, right? And everyone, was able to help her celebrate her birthday in that way. And so that is the thing I think that people, the flip side of feeling isolated, that is another way that people are able to still be in a relationship with others, because we are made, right, to be in relationship with other people. And so, it was just being able to um, be with our friends, to share this experience with her still, even though that we cannot be together physically. So I think that people are still finding ways to have those needs being met. And I am aware though that we were able to do that, but that there are still barriers for folk, because not everyone has access to internet. And so I think again that people are being very creative in how they are trying to stay in relationship with other people during this time.
Yeah, I agree.
That's a
Um,
beautiful, beautiful story. I've noticed online there are people who drive-by birthday celebrations.
Yeah.
Um, People who just sing, like let's say if a choir can't get together. I know Oakwood University did this. They sing together in their own separate homes, but then they do a nice mashup of all of the different voices, and they harmonize together just so we can have some type of semblance of a normalcy, because this time is really rough for a lot of people, because internally you don't know what the other person might be struggling with,
Right.
and to have no one there to, not even just to say hi or you look great, or things are going to get better, that it wears you down and weighs you down. So to just hear that you were able to do that for your friend is awesome, because I'm thinking about that doctor who did not have anyone
That's right.
that she could talk to, and even talking about some of the other nurses who are dealing with this. I know Lynn has a good friend of hers that went down to New York, who's a nurse, traveling nurse, and she's dealing with all of this COVID-19 stuff in a hotbed area where the spread in New York is critical stages. But now it's starting to calm down. But to know that she her outlet is to go on the internet and vlog her experience. So then she not only has an outlet, but she has now people who can say, all right, my day's rough. Okay. But she's very raw, she's very open, and she just tells you, hey, this is a challenging time, not just for you, but for all of us. And this is a time for us to just connect with one another in this unique time. Be creative in the different ways that you can show somebody else human kindness and human decency. And I think that for me is something that I hope a lot of us take out of this COVID-19, that we can connect with others in a real way to make sure that my neighbor is okay and I'm okay. So let's just make sure that we always check up on each other, and that human decency, we hope that it carries on even after COVID-19 is through.
Absolutely. Absolutely. Okay. All right. Well, listen, we have come to the end of another segment. And so we are going to break for commercial. And when we come back, we will continue the conversation.
How would you like to take your life coach with you wherever you go? Well, GCSCORED can make that happen for you. Purchase the RUMERTIME Guided Activity Journal on Amazon.com or directly from GCSCORED's online store at www.org for the price of $19.99. Welcome back to the Access RUMERTIME Conversations podcast.
Well, welcome back, ladies and gentlemen. I am Dr. Geneva Fleming, and unfortunately, I missed the first segment, but I did have an opportunity to participate and share in that second segment. And, you know, one of the things we wrapped up on, I want to thank Georges for commending Vanessa on a wonderful thing that she did to, you know, acknowledge, you know, doing some good. It's kind of spreading compassion and showing some love during such a time as this, and saying that we need more of that kind of, you know, kindness and compassion being shared. And I echo that, and wanted to also share that something else we talked about was, you know, really was the heaviness and the sadness, and shared a story about, you know, suicide, and that coming as a result of perhaps individuals not feeling the confidence or the safety in being able to speak with anyone, or not having anyone to speak to, or even feeling the shame of being labeled, you know, with a mental illness. So, you know, in this segment, I'd like for us to share our response. I say our, I'm talking about GCSCORED's response to the impact and the imbalances that has been occurring ever since this pandemic. And that is the Listening Oasis Wellness Line. Now, I'm introducing it, but I'm certainly going to ask Dr. Laria to come and chime in to, you know, tell us a little bit more about, you know, the mission and goals of this Listening Oasis Wellness Space. How does it function? How can people connect to it? Can you tell us a little bit more about it, Dr. Laria?
Most certainly would love to. So the Listening Oasis Wellness Space is the program sponsored and developed by GCSCORED in collaboration, I would say, with the Benton Spirit, the newspaper in the Southwest Michigan region. And the Listeners Oasis Wellness Space is a program that helps individuals to achieve and maintain social emotional wellness. And this wellness program is an essential service. You know, we've been talking about essential services. This is an essential service during this COVID-19 and beyond.
Absolutely.
Okay. Dr. Geneva, you sound like you want to say something else there.
I was agreeing with you that this is an essential service during this time of the pandemic and beyond.
Yes,
There's
absolutely.
so much fallout from the pandemic. It's not going to just stop.
It's not going to just stop.
Some people are believing like, okay, I'm just looking to get back to normalcy, like it's going to just stop.
Yeah, and that's not happening. And somebody said in the podcast today, somebody said something about going back to normal. And stating that we're not going back to normal. Vanessa said something about, it's changed how we evaluate who we are and our relationships and what is important. And this is an essential service. The Listening Oasis Wellness Space is an essential service because it's going to help individuals deal with a range of emotions, from vulnerable to uncertainty, so from vulnerability to uncertainty, from loneliness to panic to fearfulness to helplessness. And it provides, this is what it does. This program, Listening Oasis Wellness Space, provides an opportunity for anyone experiencing any of these emotions to have someone listen to you. Just listen, so that you know that you are not alone. And it's confidential. And most importantly, especially in these times where over 30 million people have lost their jobs, it is free. And it is operated with well-trained wellness champions who were trained in social emotional first aid. And these are the people, and they are continuously being trained and being equipped to listen, actively and empathically listen to you as you navigate, as you go through this COVID-19, the fallout of it. And we talked earlier about the social, the economic, the relational, the spiritual, the physical, all the different consequences that COVID has created, really. All these consequences that COVID has created. What else do people need to know? It's an 800 number. There's an 800 number.
Yeah, I was going to say, I mean, it is an oasis in the desert. I was about to say, it sounds like a very needed service, like an oasis in the desert, actually. A cool glass of water on a hot summer day.
Yes.
That's what it sounds like. So how can people access this wellness space, Living Oasis Wellness Space?
Right.
There's a toll-free number?
There's a toll-free number.
Okay.
And that number is 1-833-427-5697. Okay, so I will repeat that number again. 1-833-427-5697.
And so anybody can call at any time from anywhere?
Yes. You can call within the U.S. and the contiguous states. We are working on, we have an international option, which is our virtual office spaces, and you can leave us a message and we will schedule some type of virtual sessions with you, virtual listening sessions with you. Or you can call the 800 number and someone will be there to answer your call and listen and provide that support that you need during these
Hey, during this time.
unprecedented time.
Absolutely. I mean, it sounds
Yeah.
like it is an excellent resource. And for anyone that's listening, we encourage people to, jot down that number and share the information about the Listening Oasis Wellness Line. Now, there's the website. People can access it by way of.
So they can go to www.listeningoasiswellness.com. So listeningoasiswellness.com.
Thank you for clarifying.
Okay. And so that's the space that you can go to. And we have an online chat, and we have wellness champions that will be able to chat with you online if you don't feel comfortable talking on the phone or doing a Zoom virtual office. You can text, and we have that capability as well. So those are the things. Again, and we're also looking for wellness champions. If you want to volunteer to help, if you want to make a difference in the lives of people, and this line is open to every age group. Okay, every age group, children, youth, families, adults, senior citizens, and we know this COVID-19 is really devastating the elderly community. And people are we are losing the elderly in our community. And when we lose an elderly person, we're losing a part of our history and our fabric and the wisdom that comes with that. And so we should not take it lightly. And when the elderly are seeing and they're hearing that their peers are dying, imagine the fear that, imagine
it can be traumatic.
It is traumatic. Because if everybody around your age is dying,
yes,
I don't know how they are coping. And so this is why this service is an essential service for those who are in residential facilities, those who are at home, those who are living with relatives. This is an essential service for you to take advantage of. Like we said, it is free and it is confidential. It is a place for you to unburden and have someone else help you bear that burden. And that's why we're here, because we need each other. Okay, we need each other. So again, that number is 1-833-427-5697.
right. And I just want to clarify, Yvonne, did you say that this is a 24-hour a day access, or is it, what are the times?
So the times right now are on Monday to Friday from 9 a.m. to 6 p.m. And on Saturday from 9 a.m. to 4 p.m. and on Sundays from 10 a.m. to 10 p.m. So let me say that again. Monday to Friday, 9 a.m. to 6 p.m.
I believe it's been extended. I saw some recent schedules during the week, and I believe it's a bit later than 6 right now. So
okay.
I would encourage people to call, because they would have an opportunity to leave a message if no one answers.
That's correct. That's correct.
And I believe the latest schedule I saw was a 8 o'clock schedule.
Okay. Okay, so from 9 to 8, Monday to Friday. On Saturdays, on the weekends is a limited schedule, but this is a service that is growing and expanding. And that's one of the reasons we're looking for volunteers, to increase the number of hours that we are available to the communities. So Saturdays 9 to 4, Sundays 10 to 10. Okay.
Right. Thank you for clearing that up for me.
Okay, good.
Okay. Well, this has been some really, as always, great conversation, right? And we understand that there are so many issues, challenges that are coming out of this whole COVID-19 pandemic. But even beyond that, the social, emotional issues that people are dealing with. And when we meet next week, we are going to be talking about some of those other issues that people are dealing with. And so, we've had some recent things that have happened in the news that has brought a lot of anxiety, anger, frustration to, I want to say everyone, right? Because this has impacted everyone, but certainly the African American population, where we have just received another report of an unarmed Black man that was gunned down. And so we want to talk about some of those other issues that people are dealing with. And so that is what we will be discussing when we meet again next week.
And we're discussing it in light of two things. One, our social emotional wellness and well-being, or as the establishment says, mental health. And we're discussing it in terms of the additional stresses and trauma placed upon communities of color, specifically Black people in America, as we're facing an invisible enemy, COVID-19, and still in the midst of it, having to deal with the visible enemy of racism, hate, which all of these things have made African Americans or Blacks in America more prone to being at the top of the list for deaths and contracting COVID because of the health challenges that racism and educational disparities and the health disparities have placed upon us as a people to bear. So our situation is complex. On a good day, is complex. Now, when we have to deal with COVID and the continued systemic racism, the systemic disparities in health, education, economics, the judicial system, when we have to deal with all of those things, one has to know that our social emotional, the balance, that triadic balance that we talked about earlier, has to be and is negatively impacted. And so next week we will talk about the impact that COVID-19 is having on the Black community in America and the continued effects of racism on the health and well-being of African Americans.
I'm excited about next week. It sounds like it's going to be a very interesting conversation. And I implore everyone to just tune in and invite a friend as well, because we have to continue to stick together, not only within the African American community, but all communities, to know that injustice in one part of the world means that we have to make sure that we come together to make sure to eradicate those situations. But first, we have to address them. And then while we're addressing it, we're going to address the mental health aspects of dealing with those things during this rough time for our world.
All right. And as always, we like to leave with some parting words for everyone. And so I think I'll go first, and then maybe Georges, you can go, and then maybe Geneva, and then Yvonne, you can wrap us up. So what I will just say is for everyone, please to, as much as possible, try to stay connected in some way with someone, because we are all having very similar experiences throughout this COVID-19 pandemic. And so let us be a support for each other.
My final word to everyone is to make sure that you take this time to be very intentional and connect with somebody. Connect with a friend, a family, a loved one, and remind them that they are loved and they are cared for and they are cherished. And remember that it's all in your hands. You can do it. So just go out there and practice. Practice human decency and kindness.
Okay. Well, my final words would be the words of Dr. Lynn Friedli, which states that everyone has mental health needs, whether or not they have a mental illness, just as everyone has physical health needs, whether or not they are sick.
Okay, my final words are, as air is to life, so are social emotional competencies to relationships. And we want to encourage everyone to make use of the essential service that GCSCORED has made available for you, free and confidential. That is the Listening Oasis Wellness Space, where your voice matters. And so we thank you for joining us. We thank you for engaging in this stimulating conversation. And we look forward to seeing you or hearing from you next week.
You have been listening to the Access RUMERTIME Conversations podcast, where the time is always rumor time, where we equip you to solve your problems one rumor at a time, where we educate you to transform your stories one rumor at a time, and where we empower you to become your own life coach one rumor at a time. Thank you for listening, and see you next time.